Assalamualaikum warahmatullahi wabarakatuh. My name is Syauqi Hadi bin Saufi from class RSR111. Today would like to present the exercise that I had choose, which is push-ups. Push-ups are common calisthenics exercise that starts in the prone position and progresses to the standing position. Push-ups work to pectoral muscle, triceps and anterior deltoids, as well as the remainder of the deltoids, serratus anterior, coracobrachialis, and the core by elevating and lowering the body with the arms. Push-ups are basic activity that is extensively employed in civilian sports, training and physical education, as well as military physical training. They are also common form of punishment used in the military, school sport, and some martial arts disciplines. There are many muscle work in this exercise, such as pectoralis major, anterior deltoids, chest muscle, tricep brachii, forearms, bicep brachii, and joints and tendons. The target muscle, often known as the prime mover muscle, is the purpose for choosing a certain exercise. The pectoralis major or pecs is the agonist in the push-ups. Pecs are the muscle in the chest. As we lower yourself toward the floor, the pecs lengthen and control the speed of your descent. As we push back up again, they shorten. The lowering and lengthening phase of the exercise is called an eccentric contraction, while the lifting and shortening phase is called a concentric contraction. Across joints, muscles are placed in opposing pairs. When one muscle in a pair contracts, the other muscle must relax in order for movement to occur. This is called reciprocal inhibition. The antagonist is the muscle that opposes the agonist. In push-ups, there are several of antagonists, but the main ones are the middle fibers of the trapezius muscle, the posterior deltoids, and the rhomboids. While the muscle providing most of the effort in each exercise can be identified, there are frequently other muscles participating. These helper muscles are commonly referred to as synergies. These muscles are significant because they assist the agonist even though they are not exercise target muscle. The tricep and anterior deltoids or front shoulder muscle are the main synergies in this push-up. They'll help with shoulder flexion and elbow extension respectively. During contraction, one end of the muscle is usually fixed in place while the other end moves. The origin is the attachment site that does not move when the muscle contracts, whereas the incision is the attachment site that does move. The incision is usually distal or further away, while the origin is proximal or closer to the body. Relative to the incision, in this exercise, the incision muscle is bicep brachii. During the push-up exercise, the short head of the bicep brachii muscle acts as a dynamic stabilizer. This means the muscle activates at both ends. After that, the origin of this exercise is one part is attached to your clavicle, which is collarbone, while the other is attached to your upper costal cartilage, like ribs, which are positioned in the middle of your chest. That's all for me. Thank you.